My name is Deborah Conrad, and I'm a physician assistant at a local community hospital. I've been there about 15 years. I'm a hospitalist PA. I take care of the inpatients. So if you're in the emergency room and you have to be admitted to the hospital, you'll see me, and I'll take care of you throughout your hospital stay and discharge you when you're ready. I love my job. I love my job. Being in the medical field and knowing how important it is to make sure that we keep patients safe is #1 priority. January, February is when we started hearing about the pandemic, and then I remember the day that they closed churches and schools.
The fields are empty, the playground's deserted.
And that's when it really hit home for me, and I realized, okay, it's coming here, we gotta get ready. I was actually sent into a larger hospital to learn and train how to take care of potentially catastrophic situations. Many of us just had severe anxiety during the pandemic, thinking we were bringing this home to our families. There was a bunch of us that went to learn how to do mass casualty training in case we needed it. So that was a little scary, and that's kind of when it really hit home for me. The vaccine rollout went pretty smooth at our hospital. I've never experienced an emergency use vaccine or an emergency use, really, anything in my lifetime. I've been pro-vaccine. I mean, my kids are vaccinated. We rolled them out to pretty much like essential workers and that and all that first. There were many that were excited about it, and I understand we were all looking for a way out. After rolling them out then to the kind of general public, the elderly and in nursing homes in the area, we would get elderly in with COVID. It was kind of interesting. And it was weird. It was almost like a week after they would get their first dose, they would test positive for COVID. And then we started seeing patients coming in, I got my vaccination and a week later they're in with pneumonia. I can say for sure in 2021, this is the year of pneumonia. Independent of COVID, I've never seen people with so many pneumonia, sepsis. And even in the middle of summer, all summer, that's what we would get in the hospitals, pneumonia, pneumonia, pneumonia. After the vaccine rollout, I definitely noticed an uptick in heart attacks, strokes, blood clots, gastrointestinal bleeds, gastrointestinal complaints, appendicitis. We even saw pancreatitis, recurrent cancers. It was noticeably increased, where it wasn't just me noticing it, everybody seemed to notice it. It became clear to me that there was something wrong. I knew nothing of VAERS, the Vaccine Adverse Event Reporting System. I didn't know about our responsibility to report. It was never even talked about when these vaccines were rolled out. I mean, you'd hear it in the news here and there, but there was never this push to make sure providers were made aware that if you're getting patients in the hospital with issues, these issues, whatever, that here, you gotta go to this website and start reporting and start paying attention to stuff. That was never educated to us at all. And I went on the website, I looked, and the first thing I noticed was that it said healthcare providers are required by law to report certain adverse reactions to VAERS. And I said, what do you mean? Like, what law? And then you look further, and it had a whole section on it, exactly what you're supposed to report. Specific things you're supposed to report to VAERS after the COVID vaccine rollout. So that's when I started reporting patients on my own. Well, very quickly that became a full-time job in and of itself. I would say within 3 weeks to a month, I had already had 50 patients reported. And that was just of the providers that were willing to tell me about patients, recognize that there may be a problem. So I went back to my administration and I said, I need help. I can't do this all myself. It's overwhelming. I'm on the phone with the CDC all the time. I'm on the phone with these patients. I need more people to know about it so they can help me and we can do the right thing. But that was met with then resistance, because that's when the vaccines were really starting to get pushed. Everybody's got to get vaccinated. This is how it's going to go. And by me admitting that we need to report because there may be some issues, it would create vaccine hesitancy amongst the healthcare workers, amongst the staff, amongst the other staff, amongst the patients. Well, that's when things changed, because I wouldn't be quiet about it. And what I did was I put envelopes in our emergency room and told many of the providers, hey, if you get a patient that comes in and they just got their vaccine, or you think something might be related in any way, go ahead and put their demographics in the envelope, and then I'll take care of it and call the patient and get the report done. Thinking it was only going to be a few reports a week, no. It turned into, like I said, a full-time job very quickly. When you roll out an emergency use product that you're going to mass release on the population, wouldn't you assure that you have safety mechanisms in place? The first thing you would do is assure that people were educated about side effects, what to report, who to report to, before you did that. That should have been the first thing. Educate your healthcare providers who are going to see these people in the hospital. Well, then how come we didn't get educated as healthcare providers? Well, I was told we're supposed to educate ourselves. It's not their responsibility.
Why are we not wanting to report this?
I don't know that it's a matter of not wanting to report it. I think the position the system has taken is that each provider has a responsibility to report on their own patients.
But if the providers aren't provided education on what we're supposed to be reporting and the importance of such, how do they know to do it?
But I believe the providers should educate themselves when they're dealing with patients related to COVID vaccination.
They don't even realize that these are specifically the conditions that we're supposed to be reporting to VAERS.
Yeah,
So and we've had a ton of them. I mean, we get thrombocytopenia, blood clots. Just Tuesday, I think it was, we shipped out, I think, 3 cardiomyopathies, blood clots. We got a guy on the floor, and well, he just died, I just pronounced him a second ago, who got his shot, and literally 2 weeks later, the guy ends up with cancer blown out of nowhere, a portal vein thrombus, just get strokes. I had a lady that had a stroke within 48 hours of her vaccine, fully on anticoagulation. I had a lady have a bilateral PE, and she was on Eliquis after her vaccination. I know these are things that are reportable.
That our hospital system talked to their risk management team, and I was no longer allowed to report on any other patient but patients of my own that I saw, where there was a warning that I was told I must support the vaccine effort and the approach to the vaccine. You know, during the pandemic, I received an excellence award for just my patient care and just how dedicated I am. And now I'm being looked at as a dangerous individual that's putting my patients in harm's way.
Come on, boys.
These patients deserve to be heard. These injured, I have to say potentially injured, because we don't know, right? But they deserve to have a voice. They're being shunned too. They're being told they're crazy, that they have anxiety, that it's not real. They don't have anybody fighting for them. There are injured patients out there. There are people whose lives are completely destroyed as a result of these vaccines. There are people who are now in the ground because of these vaccines. I have no doubt about it. And I'm speaking out because I want to be their voice. And I hope others come forward too, because I know I'm not alone.